Pulse Talk, bringing insights into health and wellness with your hosts, Christine and Alex.
Hey everyone, ready for another deep dive.
Let's do it.
Today we're going to be talking about something that's really important, pharmaceutical waste
Oh, yeah.
in Malaysia.
Ooh.
And we've got a ton of interesting information for this one. News releases, research findings.
Wow.
We even found a video with some experts.
Cool.
So we're hoping to give you a pretty complete look at this problem.
Yeah.
And figure out, how big of a deal is it really?
Yeah.
And what are people doing about it?
Yeah, and what's fascinating here is that it's not just like an environmental issue, it's also a public health issue. It can directly impact, everyday life.
Okay, let's unpack that a little bit, because we're not just talking about a couple of old aspirin
Right.
that you find in the back of your medicine cabinet.
Yeah.
One of the press releases we came across from Alpro said that 67% of Malaysians are getting rid of their expired medicine
Wow.
the wrong way.
Oh.
So flushing it, tossing it in the trash, basically doing things that could really come back to haunt us.
Right. And you have to think about this in Malaysia.
Yeah.
Pretty much all of our water comes from surface water.
Yeah.
So if you're flushing these medications, they're contaminating the water that we're using every day.
Wow. So we could be polluting our own drinking water and not even realize it.
It's definitely a possibility, and a Malaysian Ministry of Health study even found that only 15% of the population actually knows the proper way to dispose of.
Hold on, before you go there.
Okay.
If only 15% are doing it right, does that mean the other 85%
Yeah. It's a safe bet
are contributing to the problem?
that a majority of people are probably contributing to this waste, sometimes unknowingly.
Yeah.
And that's what makes the research so alarming.
Okay.
Because they found traces of pharmaceuticals in 35%
Wow.
of Malaysian waterways.
So we're talking what? Antibiotics, hormones, painkillers.
All sorts of things that can really disrupt, ecosystems.
Yeah. And then contribute to antibiotic resistance.
Antibiotic resistance, exactly.
Wow. And that's just from tossing pills.
It's one of the contributing
And the trash or flushing them.
factors. Yeah.
Wow.
It's a very complex problem, but it really highlights the importance of proper disposal. But we also have to think about access.
Right.
Research shows over 60% of rural households in Malaysia don't have easy access to proper disposal facilities.
Yeah. So even if you want to do the right thing, it's not always easy.
It's not.
So it's not just about awareness.
Yeah.
It's about the actual means to do it.
Yeah.
Sounds like a lot of work to be done, but it sounds like some groups are starting to step up, right?
Absolutely. One of the main players here is the Alpro Foundation.
Right.
The corporate social responsibility arm of Alpro Pharmacy.
Oh, yeah.
The biggest pharmacy chain in Malaysia.
Yeah, you see them everywhere.
Yeah.
So what are they doing about this?
Well, they're not messing around. They're taking action.
Okay.
Back in 2021, they launched their Safe Medication Disposal campaign.
Okay.
And they've been doing some really impressive stuff. I mean, they've partnered with over 800 schools and universities, reaching something like 300,000 students with their programs.
Okay.
They've also installed disposal bins in all 300 of their pharmacies.
Wow, 300 bins is a pretty big commitment, but are people actually using them?
Right.
Like,
it's one thing to provide the infrastructure.
Yeah, it's one thing to have access, but it's another to actually change people's
and that brings
behavior, right?
A whole other question about what other barriers might exist.
Yeah.
But, they're trying to address that too. They've got these public awareness campaigns going.
Right.
They're even collecting pledges for safe disposal.
Right.
They've got something like 100,000 pledges.
Wow.
But they're not stopping there.
And here's where it gets really interesting.
Yeah.
They've teamed up with University Technology MRA.
Yeah.
Or UITM.
UITM.
A really prominent university here.
Leading university.
In Malaysia.
Yeah.
So what's the idea behind this collaboration?
It seems like they really want to up their game.
Okay.
Their memorandum of agreement lays out some ambitious plans.
Okay.
And it all starts with research.
Oh.
They're focused on identifying the different types of pharmaceutical waste out there, categorizing them, and even figuring out how much it all costs.
Right. So they're trying to get a handle on...
Because you got to have that kind of data to...
Specifics.
Yeah, to figure out the problem and then come up with a solution.
So what else is on the agenda?
Well, they're planning this stakeholder assessment.
Okay.
They're going to be looking at how prepared healthcare providers and the public are
Okay.
for safe disposal.
So, like, where are we?
Yeah,
Where do we stand?
right now.
Where are the areas we need to improve?
Makes sense. You kind of got to take stock of where you are
Mhm.
before you jump into action.
Yeah.
So what about public awareness?
Education is a
Is that part of it?
huge part of it.
This too.
Yeah, they're developing educational tools
Okay.
for pharmacy students
Okay.
and for the general public,
Okay.
trying to give everyone
Yeah.
the knowledge they need
So it's like
to dispose of medications responsibly.
research,
Yeah.
assessment, and education all working together. Sounds pretty comprehensive.
Yeah, a comprehensive approach.
Yeah.
And then to wrap it all up,
Yeah.
they're launching these community-based awareness campaigns.
Right. So it's like
Really get that behavior change going. Multi-pronged attack on this whole
it is pharmaceutical.
ways problem.
They've definitely thought this through.
Yeah.
And their goals for 2025 are equally ambitious.
Yeah.
They want to collect even more data on pharmaceutical waste,
Okay.
educate over 350,000 people on how to dispose of it safely,
Wow.
and expand those outreach programs to
yeah.
reach 250,000 families.
Wow, those are big numbers.
Big numbers.
And they're really going all in.
Yeah.
They're even planning on creating a dedicated landmark
Yeah.
called the Little Red House
The Little Red House.
at Alpro headquarters.
Right? At their headquarters.
So they're really putting their money where their mouth is.
Exactly. It's going to be
Oh.
this hub
Yeah,
for disposal and education.
like a symbol of their commitment to this whole thing.
It's like they're saying, we are serious about
Mhm.
tackling this problem.
And they have got some heavy hitters backing them up.
They do.
Right.
Let's hear what these key figures are saying.
Yeah, let's hear what they have to say.
All right. First, we've got Mr. Oswin Pa, CEO of Alpro Foundation.
Okay.
He's really stressing that shared responsibility
Yeah.
for a healthier planet.
They're not just on
We all have to do our part.
corporations or the government. It's
It's on everyone.
on everyone, right?
Yeah.
We've got to make responsible choices.
Right. Then we've got Professor Amrahi Buang, president of the Malaysian Pharmacists Society.
Okay.
He says proper pharmaceutical waste management
Yeah.
is essential,
It's a necessity,
not just a good idea.
not a luxury, right?
Yeah, exactly. Then there's N. Shahiri from the Ministry of Health.
Okay.
He's expressing the ministry's full support
Wow, so the government's on board?
for this initiative.
That's huge.
And he's highlighting the risks
yeah,
of improper disposal.
makes sense.
And then finally, we've got Professor Dato Dr. Yamin bin Yassin,
Okay.
the rector of UITM.
Right.
He's emphasizing the university's commitment to
Yeah.
working with the community and to sustainability.
Right.
You know, they're all about
Yeah.
collaboration for change.
So a lot of agreement, it seems like, across the board
Definitely.
on how important.
And one thing that really stood out from the video
Okay.
with those UITM researchers and those Alpro representatives
Yeah.
was the consensus on education.
Yeah.
They all agree that
Yeah.
ongoing education is
Yeah, I did a one-time thing.
absolutely vital to
Yeah.
address this.
So we got to be constantly educating people about this.
Yeah, and that's where it gets really
Okay,
interesting.
tell me more.
Yeah, because it's not just about giving people the information, you know, it's about really changing mindsets.
Right.
You know, understanding that
Yeah.
even something small like how we get rid of our medications can have
Right.
a huge impact on the environment and public health.
Yeah, it's easy to forget about the
Yeah, we're all connected.
bigger picture. And speaking of bigger picture,
Yeah.
what of the money?
Yeah. The economic impact.
Yeah, because this isn't just about
Yeah.
environment and public health. This
Oh,
hits our very
absolutely.
wallets too, right?
Pharmaceutical waste, it's not just an environmental
Right.
or health concern.
Yeah.
It also costs us money.
So what kind of economic impact are we talking about here?
Well, think about the costs
Yeah.
of cleaning up contaminated water
Right.
that's coming out of our taxes.
Oh.
And then there's the healthcare costs.
Yeah.
When people get sick from those residues.
It's like a domino effect, right? One
Yeah.
problem leads to another, and it just
You're
keeps
on-
getting
One problem leads to another.
compounds.
And then there's the cost that's harder to measure.
Okay.
What about tourism?
Oh, right.
Who wants to visit a country that's known for having polluted water?
Yeah, that could really hurt
That hurts the economy.
the economy. So dealing with pharmaceutical waste, this is an economic
It's all connected.
issue just as much as it's an environmental and public health issue.
And here's the interesting thing.
Sure.
Addressing this problem
Yeah.
could actually save us money.
Really? How so?
Think about it like this.
Okay.
preventing contamination from happening
Right.
is always going to be cheaper
Right.
than cleaning it up
Right.
afterwards.
Makes sense.
And if we can reduce the number of people getting sick
Right.
from this waste,
Right.
we save money on healthcare.
Yeah. So it's not just about doing the right thing. It's about
being smart
being smart.
with our resources.
Yeah. So it sounds like there are a lot of good reasons to tackle this problem head
A
on.
lot of good reasons.
But what are some of the challenges?
Yeah.
Because I imagine it's not as simple as just telling people to dispose of their
Right.
meds properly.
You're absolutely right. There are definitely hurdles to overcome.
Okay.
One of the biggest is the lack of data.
Okay.
We need more information about the types and quantities
Okay.
of pharmaceutical waste,
Yeah.
being generated, how it spreads, what happens to it over time.
So we need to get a better handle
Yeah.
on this problem before we can even come up with solutions. What else is kind of standing in the way of?
Well, accessibility is a major issue,
Okay.
especially in rural areas.
Right. And we can't just assume everyone has the same
You can't assume
access to
everyone has equal access.
resources.
Right.
Exactly.
What about public awareness?
Public awareness is huge.
Is that a challenge too?
Even when you have disposal facilities available,
Yeah.
people still need to know why it's important and how to do it.
So it seems like this multifaceted problem requires a multifaceted
Yeah.
solution.
It does.
Right. We need better data,
We need better
access,
and
better education.
better education. This sounds pretty daunting, but I'm still encouraged by what Alpro is doing and what UITM is doing.
It's clear that awareness is growing in Malaysia. And, there are people and organizations who are working really hard to solve this. And that's where it gets really interesting.
Okay.
The role of innovation and technology.
Okay. I'm all ears. What kind of technological solutions are we talking about?
Well, one really promising area is using technology to track and manage this waste. Some companies are developing software tracking systems that can help pharmacies, hospitals monitor their pharmaceutical waste and make sure it's disposed of properly.
So it's like giving this waste like a digital footprint.
Yeah, exactly. And that transparency and accountability could be a game changer.
It really makes you wonder, what else is out there?
Yeah.
What other innovations might be on the horizon, but beyond technology?
Yeah.
What about
the role of individuals?
What can everyday people do
That's a great question.
to make a difference?
Well, it starts with awareness.
Okay.
People need to understand the problem.
Right. Education is key. But what are some practical things people can do once they know?
Yeah, there are a number of simple things.
Okay.
Take unused medications back to the pharmacy.
Okay.
Make sure you're not flushing them down the toilet.
Right.
And store medications correctly so they don't expire too soon.
So it's all about taking personal responsibility.
Taking responsibility.
Making small changes.
Exactly. Every little bit helps.
Yeah. And if enough people make those small changes, it adds up to a big impact. Speaking of big impacts, what about the future of pharmaceutical waste management in Malaysia? What trends should we be?
Yeah. One trend is the idea of extended producer responsibility.
Okay, I'm not familiar with that term. What does?
Yeah, so that means pharmaceutical companies are being held responsible for the entire life cycle of their products, including disposal.
So it's not just on the
so it's not just on
consumers and the healthcare facilities.
Consumers and healthcare facilities.
But it's also on the
companies.
Companies who make these medications.
Are manufacturing these medications.
To make sure they're disposed of properly.
That's a really interesting...
It's a huge shift.
What other trends are kind of worth?
Another thing to watch for.
Keeping an eye on.
Is sustainable packaging.
Oh, okay.
For medications.
Interesting.
There's a lot of research on this.
Okay.
Biodegradable materials.
Yeah.
Compostable material.
Less packaging means...
Ways to just use less packaging in general.
Less waste, right.
Exactly.
To get a start.
It's about closing the loop.
It's encouraging to hear about all these positive developments and the progress that's being made. But I'm curious, what are your thoughts on the future of this in Malaysia?
Well, it's a challenging issue for sure.
Yeah.
But I am optimistic.
I think with collaboration, innovation, and public engagement, we can create a sustainable future.
Yeah.
But there's something else we need to talk about.
What's that?
We've talked a lot about the data and the policies and the technology.
Right.
But I think we need to focus a little bit
Right.
more on the people.
Okay. Yeah, because we can have all the disposal systems and the fancy technology.
Right.
If people aren't on board,
If people aren't,
then it's kind of pointless.
exactly. And it's really about the choices we make.
Yeah, so it's kind of about understanding the psychology
It is.
behind people's behavior.
It's not enough to just tell people what to do.
Right.
We have to understand why they do it.
Right. Yeah.
What motivates them.
Yeah. How do we encourage them to change?
Yeah.
How do we bridge that gap?
Yeah. How do we get people to really care and take action?
Yeah.
Well, you know, those traditional awareness campaigns, those can help.
Right.
But I think we got to get a little more creative.
Yeah.
We need to tap into something a little more powerful than just like facts and figures. We need to tell stories.
Stories. Okay. What do you mean by that?
Think about it.
Okay.
Data and statistics, those can be informative.
Yeah.
But they don't always hit you.
Right.
In the feels.
Right. They don't really resonate with you.
Yeah.
Emotionally.
But stories can grab our attention.
Yeah.
Make us feel things and make us want to do something.
So what kind of stories could we tell about pharmaceutical waste?
Well, we could share stories of people who've been directly impacted.
Okay.
You know, maybe their well water got contaminated.
Right.
Or they got sick from those residues. I mean, those stories.
Yeah, it's one thing to hear about the statistics, but it's another to hear about real people.
Exactly.
Who have been affected by it.
And we could also tell stories about the people making a difference.
Okay.
Highlight the work of volunteers,
Okay.
researchers, everyday people who are making those responsible choices.
So show the positive examples so people realize they can
show the positive examples, exactly.
see the difference.
Let's move away from that doom and gloom and focus on the hope and the empowerment.
Yeah. So it's not just an environmental problem. It's a human problem.
It's a human problem.
That affects all of us.
It affects all of us, and that's where it gets really interesting.
Okay.
What if we asked everyone to tell their own stories about this?
Oh, that's a great idea. Like, get people to share their experiences.
Exactly.
Maybe their concerns, their ideas.
Exactly.
Maybe even create a platform for people to share their stories.
That could be a great way
and connect with others.
to raise awareness, build community, and inspire action.
This deep dive has been incredible. I feel like we really got into the nitty-gritty of this issue.
We did. We explored the science, the economics, the human element.
Yeah.
It's complex, but there's a lot of hope out there.
Absolutely. And for anyone listening, we hope you'll take this information and think about what it means for you and your life. Even small changes can have a big impact.
They can. And if you're feeling inspired, tell your story, talk to your friends and family. Keep this conversation going.
Thanks for joining us for this deep dive on pharmaceutical waste in Malaysia. And remember, we all have a role to play in creating a healthier and more sustainable future.